to another session of medical coding made easy. So now today we are dealing with eye and ocular adnexa. Codes 65,091 to 68,899 part 1. So first we can go through anatomy of eye. Eye has 3 layers. Outer layer is called as sclera. In front it is sclera becomes cornea. Again, in front of cornea there is a transparent layer called as conjunctiva. Second layer is choroid and third layer is retina. That is the innermost layer is retina. Then we can see the lens. Okay, there is iris, ciliary body, ciliary muscle, and this is vitreous chamber, and in front of lens we can see aqueous chamber. Okay. Then behind there is an eyeball codes of 65,091 to 65,290. So here we can see how we can find a term. അതായത് ഒരു medical terminology, for example, enucleation. We don't know what is enucleation. Then just go through the title, removal of eye. So enucleation means removal. Okay. And അടുത്ത first 3 codes നോക്കുകയാണെങ്കിൽ enucleation of eye 65101, 103, 105. 3 are the topic is enucleation of eye. But what is the difference? The first code is without implant, and next 2 codes are with implant. But still there is a difference. 103, 105 both are implants, but in 103 muscle is not attached to implant. In 105 muscle is attached to implant. Same is we can see in the below codes, that is removal of foreign body 65205. So first is conjunctiva superficial, other is conjunctiva embedded. 65220 these 2 codes are also removal of body from cornea, but without slit lamp, with slit lamp. Same 65235 removal foreign body from anterior chamber. 260 posterior segment. 265 is also posterior segment, but in 260 it is magnetic extraction. 265 is non-magnetic extraction. Next is repair or laceration. 270 and 272, 273 all are repair, but 270 is without not perforating laceration sclera, that is direct closure. 272 is conjunctiva by mobilization rearrangement but without hospitalization, and 273 is with hospitalization. So let's see an example. John was hospitalized for a repair of laceration to his left conjunctiva by mobilization and rearrangement. How should you report this procedure? To save time, first we can go through these 4 codes. So 65270 is repair of laceration. 272 is laceration conjunctiva without hospitalization. The next code with hospitalization. And 67930 is the suture of recent wound. So question we can see was hospitalized. Upper code with hospitalization ആയിരിക്കണം. And here we have one code 65273. So we can check words ഉണ്ടോ നോക്കാം. That is there is the mobilization and rearrangement, hospitalization, and this is a repair of laceration. So all terms are there. So we can go to 65273 left. So answer is A. So the answer is A. 65273 LT means left. Now we can see anterior segment. Anterior segment is the front third of the eye that include the structure in front of the vitreous humor. അതായത് cornea, iris, ciliary body, lens. ഇതെല്ലാമുള്ള പാർട്ടാണ് anterior segment. Within the anterior segment, there are two fluid-filled space, posterior chamber between the iris and the front face of vitreous. Okay, അതായത് anterior chamber, ഇവിടെ ഉള്ളതാണ് anterior chamber, and posterior chamber is between iris and front body of the, this is the iris. Iris and front face of vitreous. This space ആണ്. Now the next part is cornea. Cornea is a transparent, avascular, watch glass-like structure. It forms anterior 1/6 of the outer fibrous coat of the eyeball. The outer fibrous coat is the sclera. So cornea codes are 65400 to 65785. So keratoplasty. So ipo anatomy or medical terminology part la keratoplasty varayanengil you will have 4 options. From that we can see this keratoplasty comes under cornea. What is plastic? This comes under repair. So keratoplasty is a procedure whereby abnormal corneal tissue. Now anterior chamber. 65800 to 66030. Then there is a trabeculoplasty. Is a laser treatment for glaucoma. All these are in the textbook. Okay. Now, what is anterior chamber? Anterior chamber is in the anterior segment. We studied anterior chamber and the posterior chamber under. This is the anterior chamber codes. Now next two structure are iris and ciliary body. Same ciliary body ivade. Iris is the front. Iris ciliary body cords. There is an excision. So ectomy. Ectomy means excision. All the ectomy cords come from excision. And otomy. Iridotomy is or iridectomy is in the destruction. Now next is the lens. So this is the lens in the parts. It has got nucleus, cortex, capsule. Lens codes are 66820, 66999. And you can get just incision, otomy, and removal is ectomy. Removal, just you can go through what is the difference between each codes. Now 66982, it is extracapsular cataract removal. 983 intracapsular cataract extraction. So just go through whether it is extracapsular or intracapsular. And 66990 is use of ophthalmic endoscope. It is an addition to add-on cord. Next is posterior segment, vitrectomy codes, repair. These codes are important. Then next is prophylaxis, without drainage, one or more session, cryotherapy, photocoagulation, 67229, treatment of extensive or progressive retinopathy in preterm infant. So, another example, an infant born at 33 weeks underwent 5 photocoagulation treatment to both eyes due to retinopathy of prematurity at 6 months of age. The physician used an operative microscope during this procedure. These treatments occurred once per day for a defined treatment period of 5 days. How would you report all of this service? So, first we can go through all the choice. Is 67229. 67229 is treatment of extensive or progressive retinopathy, one or more session means any session, preterm infant, that is less than 37 weeks gestation at birth, performed from birth up to 1 year of age. So 33 weeks. So less than 37 weeks. 5 photocoagulation treatment. This could include 1 or more session. So any number of session. Both eye. So for bilateral procedure we have to use modifier 50. From these 3 clues we can go to which code? A. 67229 50 modified. We have to exclude this code because 1 or more session. No need to put into 5. Okay. Now what is 69990? 69990 is operating microscope. And this should not be reported with 650912 68850. So our code comes in 67229. So this is in between. So the answer is A. Answer is A.